Welcome to On the Beat, everyone. I'm over here with Dr. Starr from Golden Triangle Periodontal Center, and today we're working together with your general dentist. Now, you may say to me, what do you mean a general dentist? How are you, my friend?
I'm fine. Glad to be back.
So explain to everyone at home what a general dentist and a periodontist is. What's the difference?
Well, when you go to dental school and you graduate and you get your license to practice, you're a general dentist, and you can do further training. You can do a general practice residency, you can do specialists in a lot of different fields. I chose periodontics because that's my passion.
Right. Okay, so can a general dentist do periodontal disease? Can they treat that? And what is periodontal disease?
Well, periodontal disease is gum disease, and to answer your question is yes, they can treat it, and they are trained that way in dental school, and there's certain levels of treatment that they feel like they can do. In a more advanced cases or more complicated cases, they would send that out of their office to me to handle, because I concentrate just on periodontal disease and dental implants and that sort of thing, whereas they're looking at generally all types of dental treatments.
Okay, so when we talk about advanced periodontal disease, explain to everyone at home what that is.
Well, it's basically an infection of the gums from a bacterial insult and the body's immune system combating the bacterial infection, and the subsequent loss of bone, which creates pockets and it escalates, and you eventually can lose teeth.
Well, when you say loss of bone, you're saying the bone shrinks?
Resorbs. It actually resorbs.
How is that possible?
Well, it's a specialized bone, alveolar bone, and its job is to hold the roots of the teeth in place. And so when there's a fight going on, the body fighting the periodontal pathogens, then the inflammation, that battle, the loser is the bone. It's running from the fight, so it resorbs and goes away. And eventually you get to the end of the tooth, and the tooth falls out, so you lose it.
So is that an age issue?
No, it's inflammatory response. It's a disease like diabetes.
Okay.
Yeah.
Well, how do we stop getting that issue?
Well, the first thing we do is prevention, and that's what the general dentist does a lot. When you go to your general dentist, get your teeth cleaned, the hygienist is checking you, and he's checking you, or he or she is checking you, and determining if you have periodontal problems, and if they do, they intercept them early, then I'll never see them.
Right.
And that's what their job is, and that's what they do. But if it gets beyond the point that they feel comfortable treating, then I'm called in.
So basically you're the last stage before serious, like, pulling teeth out?
Yes, and we're trying to save teeth. That's our job, is to save teeth.
Can you practice general dentistry as a periodontist?
No, our licensure requires me to stay within my field of specialty, which is the treatment of the alveolar bone supporting structures for teeth and dental implants and that sort of thing. But I cannot do fillings, for example.
Okay.
Yeah.
I got you. All right. Well, let's just ask, as our clients are at home watching us and we're thinking to ourselves, well, I just go to a family dentist. What do they need to communicate with you, and what do we need as patients to bring to you if we are at that next level and we're told to come to you?
A huge part of dentistry is education, because you need to teach your patients why you're looking for the things you look for and why you treat the things that you treat. And that starts at the general dentist level, and with the hygienist and assistant and the dentist. And it's really a team approach for health. And so at some point, if they get to me, then I'm going to teach you all about periodontal disease, more than you want to know, and that way you're aware, because once I get you well, we got to keep you well. And just because you're well doesn't mean you're going to stay well, just like diabetes. It's you got to manage it the rest of your life. And so once we get it under control, it's easy. Just routine cleanings, we alternate with the general dentist, we work with the general dentist.
And that's what I was about to say, because once you'll fix the problem, that's when I'm going back to my general dentist and maintaining.
Correct. And we'll alternate. They'll see you one time, I'll see you the next. We typically decrease the interval of time from 6 months to 3 months, and then that's what the study shows works the best for the treatment of the disease.
Well, Dr. Starr, as always, great information. We appreciate you. Thanks for coming in again.
Thank you so much.
If you want to find out more information about Golden Triangle Periodontal Center and Dr. Starr and his amazing team, and working together with your general dentist, all that information is up on the screen. We'll be back after this short break.